This is Nancy. She's the patient today. This is her first visit, as I said earlier, and she's willing to have us film the session. She's very nice and brave, and it's very nice of her to help us out. We're going to start by bringing the table down. Slide up a little. Okay, that's fine. We're going to very gently stretch out the ligaments in your low back and sciatic nerve. Very good. Put this foot on the table, hand on your belly. I always make sure the person's hand is up here on their stomach. I never want to sit on the person's hand when I'm stretching out the hip. Here we go. We're going to very gently stretch out this hip, the ligaments in the tendons. Straighten out your leg. We're going to now very gently just open up the wrist. That's it. Relax, relax. I start every visit with what is called a zero balancing. Put this foot on the table. That means you basically balance what Fritz Smith called the foundation joints of the body. Hips, neck, wrists, things of that nature. Here we go. We're going to open up this wrist. Relax, Nancy. Relax. That's it. Very good. Okay. Now this is part of the zero balancing. This is not a normal chiropractic neck adjustment. Lift your head. Let your head rest. Very gently, a little traction straight up. Good. Here we go. Relax. Very gentle balancing of the cervical spine. This is not an adjustment. I'm not cracking her neck. Relax, Nancy. Relax. Let your head rest. Let your head rest. Very good. Okay, here we go. Good. Relax. That's it. Here we go. Okay. Turn your head to the left. Relax your head. Is it sore here?
Yes.
We'll open this up then. Let it go. Here we go. A little pull straight up. Head to the right. Relax your head. Is it sore here?
Yes.
Relax, relax. Lift your head. Very gently let your head fall back into the palms of my hand. Just breathe into my fingers. That's it. Take a deep breath in. Exhale. Relax your head and neck. Little pull straight up. Very good. Okay, that's how I start every session. Just a general overall balancing of the body. Okay, I am now going to start by checking individual muscles, and I'm going to check to see if they're strong or weak. If you look back in the website, it'll talk about, look into the section, how it works. It'll talk about how structure destabilizes. Muscles start locking up in order to pull the structure back into place. That's when you start to feel sore. When it gets to the point where the muscles can't compensate anymore, they become what I call neurologically deficient. Again, this is all described in the website under something called muscle balancing. Now, I'm going to show you some what I call neurologically deficient muscles. Nancy, I'd like you to lift your leg. I'm pressing from here to here. Resist, hold. So you notice she can't hold her leg up. Drop your leg. Other foot up. From here to here, hold. She's unable to hold that leg up. I'm going to push in here. Hold. She's resisting. She can't hold it. I'm pressing out. She's resisting. Hold. I'm pressing out. You resist, Nancy. Hold. Can't do it. See, she tried. Compensating, but couldn't hold. Lift your head off the table, Nancy. I'm pressing down. Resist. So you notice she cannot hold her head up. Okay. What we're going to do is fix all that, get everything going. This is an activating adjusting instrument. I'm going to use it to make sure her shoulders are in so I can do muscle testing effectively. How are your shoulders, Nancy?
Good.
Is this one bothering you?
No.
Okay, so I can use it for muscle testing,
Yes.
correct?
Yes.
Okay, to start off with, I'd like you to lift this shoulder off the table. All right, can you see this? I'm going to press down, resist, hold. She can't hold that up. I'd like you to rub here, rub there, right below your sternum. Rub, 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 rub. Stop, lift the shoulder off the table. Hold, it's strong now. What we did is we took the pec minor muscle, tested it. It was weak. We then rubbed what are called neurolymphatic and neurovascular points in order to clear the lactic acid and calcium out of the muscle, and then it worked properly. Okay, now we're going to start. Arm up, make a fist, hold. Is she switched? Yes. Drop your arm. Okay. Okay now. Okay, she's switched. The brain communicates up, down, right, left, back, and forward. First thing I do is make sure the brain is communicating with itself properly. Now the brain can switch in a variety of ways, so first we have to do muscle testing in order to figure out how it's switched. Where's your belly button? Please, show me your belly button. Okay, I'd like you to put your hand about an inch below your belly button. Hold. Okay, the arm went weak. That means that the patient is switched on what is called deep switching. There's 3 different levels of switching. She's in the medium level. Okay, that is now pause locked and stacked in circuit. Okay, put a finger in your belly button. Hold, fingers here and here. Hold, left hand on the table. The arm went weak when she held the 2 kidney 27 acupuncture points. That means that she's switched right, left. Okay, drop your arm. What we do now is we take finger modes. We go into our acupuncture system, central meridian. Pause lock, in circuit. We're now in her limbic system. Weak. We're now specifically in the amygdala, that part of the limbic system. Drop your arm. I'm doing Reiki on her central meridian in order to clear her switching. Okay, that cleared it. Play it. Okay. This is the second balancing you do for switching. I work with a lot of people that have learning disabilities, things of that nature. This is huge for getting people's eyes, ears, and mouth to coordinate together. Arm up. Is she switched? Okay, we fixed the switching. Okay, we're now going to start doing muscle testing to understand what we need to do next. I'm going to check her diaphragm. You know what the diaphragm is. That's what you breathe with. Hold. It's weak. The diaphragm needs adjusting. Psoas muscles on right and left. Both need adjusting. Okay. We're going to adjust your diaphragm. Do you know what that is? Nancy, do you know what your diaphragm is? It's the muscle you breathe with. It's spasm. We're going to adjust it. Take a deep breath in. Exhale. You're going to feel this a little. I'm sorry. Okay, we're now going to do psoas muscle on the right. Put your right foot on the table, please. Raise your right leg all the way up. Let it drop fast. Put your left foot on the table. Raise your left leg all the way up. Let it drop fast. Okay, we just balanced her diaphragm and psoas muscles. I'll explain to you later on in the session why it needed adjustment and how we adjusted it. Arm up, hold. We're now going to go to work and see what there is to do. Take your right foot rotated in from the hip. Hold, straighten out your right leg. Left foot rotated in. Okay, arm went weak when she straightened out, rotated her left foot in. That means that the left hip is jammed up into the acetabular or the socket. Hold. Also, her left hip is out. So we're going to start by working on the left hip. Okay, I pause locked or stacked in circuit, that hip being out. Go into the website, look under pause lock, understand what it means. Okay, essentially I have her left hip on the computer screen. Okay, now my option is now SIPS. I'm going to do SIPS, yes. Hold, SIPS ligaments, tendons, muscles are involved. There's inflammation in the hip. Foot pad receptors are involved and the dura is involved. Okay, SIPS 1. We're now clearing the hip on those levels. We're now holding SIPS points. That means I'm draining energy off her meridian system, specifically in relationship to her left hip. Again, go back to the website, it'll explain what this all is. Arm up, hold, I turned it off. Okay, joint capsule. Okay, we now have to do the joint capsule of the left hip. What I did is just stacked in acupuncture points reflecting different aspects of the outer joint capsule on her left hip. Sips 1, sips 2. Fingers there and there. Leave your hand where it is, drop your arm. We're now doing sips on the joint capsule of her left hip. Take your hand away, arm up. Okay, the joint capsule has an inner and an outer part. We did the outer, we're now doing the inner part of the joint capsule. Sips 1, drop your arm. Okay, holographic. We are now doing a technique called holographic healing on her left hip. Hold, 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 hold. Shrug your shoulder to your ear. Hold, relax your shoulder. Sound. Now putting sound into her mastoids in order to balance what we just did. That's it. Perfect, perfect. Okay. Hip. Okay, we are now going to do a chiropractic adjustment on her left hip. Nancy, roll towards me, please. Straighten out your top leg. We're now pulling the hip out of the socket. Roll onto your back. Put this foot on the table. Arm up. Hold right there. Hip is adjusted. We just put her left hip in. Okay, put this foot on the table. I'm going to move this knee to this shoulder. Relax. Hold, hold. Straighten out your leg. We now tested the SI joint. It was out. The SI joint has two parts, a top and a bottom. Again, go back to the website. Hers is out on the top. Hold. Hold, hold. Okay, again. Sips. Ligaments, tendons, muscles. Inflammation, foot pad receptors, duras involved, sips 2, fingers there and there. Leave that hand where it is, drop your hand. Hand away. Okay, joint capsule on the left SI joint. I'm now stacking in the points for the joint capsule. Okay, sips 1, and then we clear it. Okay. Let's see. We did the outer joint capsule. Now we're doing the inner joint capsule of the SI joint. Sips 1, sips 2. We do sips 1 down here. You okay there, Nancy?
Good.
Good, good. Okay, arm up. Inner joint capsule. Holographic, yes. Hold, 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 hold. Throw your shoulder to your ear. Hold, relax your shoulder. Sound, drop your arm. We did it holographic on the left hip. Left SI joint. Got it. Okay, you don't look comfortable, Nancy. Let me put a pillow under your head. I think you'll be happier. So she's smiling now. Okay. Holographic figure 8s. We are now doing something called figure 8 healing on the SI joint. Look in the website for figure 8 healing under energy techniques. Okay, no figure 8s. Going down. Roll onto your left side. We're now doing a chiropractic adjustment on the left SI joint on your back. We're now blocking the hips with orthopedic blocks in order to stabilize the sacroiliac joints. Put your right foot on the table, please. Straighten out your right leg. 2 fingers behind you. I have to take this away, I'm sorry. Okay, we're now looking for the cranial work that we have to do in order to stabilize her SI joint. Hold. 2 fingers behind this ear. Hold. Left hand on the table. I have to adjust her left temporal bone. 2 fingers on your jaw. Hold. Jaw. Hold. Jaw on the right side needs adjusting. Put a finger there. Hold. Finger there. Hold. Relax. Turn your head to the left. Chiropractic adjustment on her jaw. Okay, we're now doing cranial work for the chiropractic adjustment. There's no pain with this. Doesn't hurt. Open your mouth. Deep breath in. Out. In. Out. Okay, we're now adjusting her left temporal bone. Deep breath in. Out. In. Breathe. Okay. You doing okay in there?
Yeah.
Okay, now the next thing we're going to do is balance. We're checking her Achilles tendons. They need balancing. Her iliotibial bands, these are from the hip down to the knee on both sides. They need adjusting. Diaphragm needs clearing, and across the shoulder needs clearing. That's called the yoke. Okay, now we have to figure out where to start. Start with the heel cords. One of the things she presented with in the case history was foot pain. So it's appropriate that we would start releasing the Achilles tendons. Stack more. What next? IT bands along with it. Okay. There. Sips 1, sips 2. Fingers there in their left hand. Leave that hand where it is. Drop your hand. And we're doing sips on, let me see, IT bands. Hand on the table. Okay, that released the Achilles tendons, the IT bands. Next thing is yoke, across the shoulders. Points stacked in. Also diaphragm. Points stacked in. Sips 1, sips 2. We're now releasing the diaphragm and the yoke, or the area across the shoulders. Got it. Arm up. Okay, that ends basically the starting part of an adjustment. As you remember, at the beginning of the adjustment, we went through and showed a variety of muscles that were not working properly. I'd like you to look at Nancy now. Raise your head off the table. Hold it up. Hold. She can hold her head up now. Okay, lift this leg up. From here to here, resist. She can hold that leg up now. Foot up. She can hold that leg up now. I'm pressing in. Resist. That holds. I'm pressing out. Resist. Hold. Relax. All those muscles were weak. They're all strong now. Things are working. Okay. Where to next? Your knees are okay.
Okay.
Ankle. Only one ankle. Did you twist this ankle or something?
It's probably that foot that hurts, maybe.
Trauma? Yeah, but the ankle goes, the foot goes. Anyway, sphenoid bone. Do an up ledger now. I have to adjust your sphenoid bone. Another cranial move. She has a problem with her right ankle. Go to the website, read about ankles, ankle sprains, and avulsion fractures. Part of it talks about the sphenoid bone in relationship to the neurology of the lower legs. I'll show you what I mean. Arm up. When I pull her foot out, her arm goes weak up here. That means there's a stressor on the muscles on the inside of her leg here. We're going to adjust her sphenoid bone. When her sphenoid bone goes out the way it is, the neurology on the outside of the leg stops working properly. Therefore, these muscles compensate, work overtime. Everything that's going on here is the result of a cranial component. Drop your arm. Lift your head, relax your head. Okay, I just balanced her sphenoid bone. The bone that goes directly to the middle of your head. All the neurology of your eyes goes through the sphenoid bone, going from the back of your brain into the eyes, the eye muscles, the eye neurology, optic eye nerve, all those things. I just did a huge amount to open up her vision. All these things come together. Hold, hold. It's strong now when I test this muscle group. Okay. Hold. Put 2 fingers on the clavicle. 1, 2 fingers right there. Hold, hand down. The clavicle is out, it needs adjusting. Roll onto your right side. That's your left side. That's it. Onto your right side, please. Let me have your head. Come on over here. Here we go. I adjusted her clavicle on your back. Okay, now we want to see if there's anything else in the shoulder that's not working. 2 fingers right there, left hand. Hold. Hold. Okay, the shoulder is not too bad. We needed to adjust the clavicle. Take your hand, cup your neck, but the neck is very tight. Left hand on the table. Okay, shoulders are good. Problem with the neck. Okay, we're now going to do sips on the neck. Sips, hold, ligaments, tendons, muscles. There's inflammation in the neck. Foot pad receptors are involved. The dura's involved. Sips 1, sips 2. Fingers there and there.